Hello everyone, this is my project on Kaposi Sarcoma. Uh, just wanted to say something about it, that it's basically called the AIDS-defining disease, where if patients had this disease, it was considered that they had AIDS, but let's talk a little about it. Um, it is a cancer that develops from cells that line like connective tissues or lymph or blood vessels, and they usually appear as tumors on the skin or the mucosal surfaces, like inside the mouth, but they can also develop like all over the body, such as other organs. Well, here's a picture, as you can see, of somebody who has KS all over their chest and all over their arm. And these are the abnormal cells. They could be purple, red, or brown blotches or tumors in the skin, and usually they're called lesions, and they appear mostly on the legs or face of a patient who has it. They may look bad and may be bad to look at too, but they usually cause no symptoms. Although sometimes some of these lesions can cause the legs or area around the groin to swell, and it could be painful too. Alright, is it a virus, bacteria, or fungi, etc.? Well, clearly it is a virus because it is associated with herpes, HIV, and AIDS, which is also a retrovirus. But also, um, the human herpes virus is found in the lesions of all patients with Kaposi sarcoma. Most people infected with the human herpes virus do not get the Kaposi sarcoma, but those infected with human herpes virus who are most likely to develop Kaposi sarcoma have immune systems that are weakened by the disease, which makes them more capable of catching the sickness. Well, I talked about some of the symptoms. Now let's talk about some of the treatments. The first treatment I have up there is radiation therapy. Sorry. This is a cancer treatment that uses high energy X-rays or other types of radiation to kill cancer cells or keep them from growing. There are two types, external and internal. External radiation uses machine uh, for outside the body to send it toward this cancer. Oof, having trouble. Internal radiation uses radioactive substances that are placed directly into or near the cancer. Chemotherapy is the next therapy up there. It is a cancer treatment that uses drugs to stop the growth of cancer cells, either by killing them or stopping them from dividing. It is taken by mouth or an injection into a vein or muscle, and these drugs enter the bloodstream and can reach the cancer cells throughout the body. Surgery is the next type of therapy I have up there, and it's usually the procedures are used to treat small surface lesions. For example, a local excision, where the cancer is cut from the skin, along with a small amount of normal tissue around it. You have saurosurgery, which is a treatment that uses an instrument to freeze or destroy abnormal tissue. And you also have electrodesiccation. This is where the tumor is cut from the skin with a curette or a sharp spoon-shaped tool. Uh, a needle-shaped electrode is then used to treat the area with an electric current that stops the bleeding and destroys the cancer cells that remain around the edge of the wound. Now, the last one, the biologic therapy, is a treatment that uses the patient's immune system. So basically, the body fighting the sickness. Now, what I didn't include was the highly active antiretroviral therapy, which is HART, which is used to slow the progression of AIDS. It's basically an anti-cancer drug that it gets mixed with other drugs and medicines and used to prevent and treat the infection. Classic Kaposi sarcoma is found most often in older men of Italian or Eastern European Jewish origin, and it is a rare disease that gets worse slowly over many years. And African Kaposi sarcoma is a fairly common form of the disease found in young adult males who live near the equator in Africa. The symptoms can be the same, however, these symptoms are much more aggressive, that they cause sores on the skin and spread from the skin to the tissues to the bone. This type is not really that common in the US. There's another form of Kaposi sarcoma that is found in patients who have organ transplants. Their immune systems are weakened by the drugs that they take because they don't want their body to attack the new organ, and when their body lowers the guard, the Kaposi sarcoma can enter and infect. Although it does affect AIDS patients, it also can be found in homosexual men who do not have HIV or AIDS, but this is also very rare. Now, one of the questions is, does this pathogen affect AIDS patients differently? And I have to answer that question by saying yes, because if you see these violet lesions on these people, then you know that they have AIDS. And here's my works cited. I hope you enjoyed this presentation. Um, I had a good time doing it, and I can't wait to read other people's and listen to what they have to say about theirs. Thank you.